그러면 시작을 좀 할까요? Okay.
So this is me. So I'm Dr. Amanda Wigelsworth. I am basically something called theme lead for medicine and clinical practice. So in our university, the medical school is split into two phases. We have first and second year, where you learn all the basic medical sciences. So anatomy, physiology, how the body works normally. And you have a couple of placements where you see patients, but it's mostly that learning. When you come to me in years 3, 4 and 5, particularly in when you come into year 3, you'll start mostly being on placement, being in wards, in hospitals, in clinics, seeing patients. And you'll come back to me 1 day a week to then think about how do I put those first two years of anatomy and physiology and how the body works, how do I put that together to learn about what is the diagnosis? So when a patient comes in, is it a heart attack or is it a lung problem? And being able to work out why, and that's my job, is to help you piece that together. So I'm part of the SMT, which means senior management team. So I'm part of the leadership within that team. There's 5 of us within the team. And I'm a general practitioner. So I work as a general practitioner in the United Kingdom, but I work mostly in urgent care and accident and emergency, so emergency departments. I was part of this university 25 years ago, when I did nursing first. So I was a nurse first, and then I went to a different university to do medicine. So my route has been very windy, but so yeah, I went to a different university to do medicine because they didn't do medicine. We're a relatively new medical school within the country, but we've been going for 10 years now. So lots of graduates from our university. And there's a zebra and a horse here because this is what I do. Basically, when you hear, hoofbeats, it's going to be a horse, isn't it? Running down the street, not a zebra. So this is where I help you to piece together things. So when a patient comes in to clinic and they've got chest pain, it's likely to be a heart attack, which is our horse because it's common. It's a common thing. But actually, you've always got to have in your mind, zebras exist, so it might be something unusual. And I teach you and I help you to learn the difference and which one it will be. Yeah? This is our university in numbers. So I'm not going to read through it all because you can read and you can have the slides as well. But we are really proud of our our numbers, essentially. We're the 3rd largest university in the northwest of England. So the northwest of England is my home. It's where I've lived my entire life. I'm from a little coastal town called Blackpool by the seaside originally. I still live in the northwest of England. We have a massive alumni, and I'm proud to be one of the 200,000 plus alumni for the university. So you might see that we're no longer called the University of Central Lancashire, we're now the University of Lancashire. And that's because Central Lancashire isn't really a place, it's kind of in the middle of a space. And actually, this represents that we cover quite a big area. Our students come from far and wide, basically. But we have been around for a very long time. So when I was at university, it was this symbol. So yeah. Where are we? So I'm sure if you know about us already, so we are in Preston, and this is our main campus, essentially. And we are very close to major transport links. So I live in Manchester, which is about 45 minutes away, and I travel up. But this is where our major airport is. This is where I came from. This is where I travelled to here from. I know that it is a long way from, England is a long way from home, but we do have really good transport links. So we also have very good transport links to London. So we have direct trains down from Preston. down to London. It's about 2 hours to the major capital. Manchester is also the major city. It's about 40 minutes on the train. The campus that I tend to work at is Burnley. So when you come to years 3 and 4 and 5, you come across to Burnley, and we have a bus that just brings you over from Preston, and it's about 15 to 20 minutes down the road. But that's because you're only with us 1 day a week, because mostly you're out seeing people, you're out on placement. But we have a wide range of placements also up in our Lake District in the West Lakes. And this is where people learn about rural medicine. So, you know, patients up here, they might not have medical access for several hours. So how do we treat them? What do we do? It can be slightly different. So we also have the campus in West Lakes. We are a city, but it's a smaller city, it's a safe city. And it's also one of the most affordable cities to live in. And, you know, you can talk to Millie about the affordability of living within Preston. It is much more affordable than places like Manchester and London and places like that. And we are very multicultural. I think it's around, is it 1 in 4 people in Preston are students? So the university is a massive part of the city, absolutely massive. And it's geared to that. So a lot of the services and things like that around it are geared towards the students. For parents, it's really important to know that we support people very well. So within the university itself, we have a lot of mental health support, well-being support, academic support, but also within the medical school, we know that medical students, it's a long degree, most students are international, and it's hard work doing medicine. We know this. So we have an extra team that work just with our medical students to help support them. And that's just for the medical students. I'm going to skip over this because this is about sort of the other healthcare professionals that we also train. But I think it is important to know that because our university does train all these other kinds of specialities, that actually you get access to them as well, which is important because you're going to work with them as doctors. No matter where in the world you practice, there is the version of this somewhere, and you'll learn about their job roles and how they can help and support patients as well as yourself. So as a doctor, you're one part of the healthcare team. So medicine itself, we are accredited by the General Medical Council, and we do have a very, very supportive and diverse learning environment. I think our facilities are amazing. You know, I think a lot of people will say that, but I think they are. Our laboratory space, our lab space is amazing. It's all been refurbished. It's all brand new. We are embracing AI and virtual reality as well. And one of the big things that people ask about is the success rate of graduation. If you are capable of getting into medical school, you are capable of graduating medical school, okay, if you work and if you come to class. We see a very big correlation between those that come to class and engage and the pass. Yeah? So that's the important thing. Like I say, we've got students from all over the world, 40 plus countries, and we do have a big assistance programme in when people are coming. There's lots of different societies and groups. We have quite a large number of students from South Korea and Hong Kong, and you know, that all meet up very, very regularly. I think South Korea is our sort of second largest cohort, so we have a lot of students from Hong Kong, and then South Korea is the next. I have about sort of between 6 to 10 students for every year, every one of the 5 years that are from South Korea. So that's quite a few. So Preston, like I say, it's multicultural. Burnley as well, we're only 20 minutes away. That's where you come for year 3 and 4. And then the West Lakes is the remote and rural type medicine. These are just some of our facilities. So this is somebody learning how to do an ultrasound scan. We teach that within the medical school. And this here is called an anatomage table. And imagine the size of this room, a big table. We have them flat, but also upright. and you can dissect through the layers of the body, and you can see the beating heart within the chest. So we have these in our anatomy labs. This is virtual reality, so this is what the person's seeing, and it's a virtual ward. And this allows you to practice safely before going out onto the patients. This is our degree, basically. So I look after these two big red blocks here, Medicine in Clinical Practice 1 and Medicine in Clinical Practice 2. And this all kind of links in with skills, so how to take blood, how to put catheters in, how to put lines in here, how to examine people, and it all kind of links through, okay. I'll let you read these in your own time, but these are just some of the ways that students feel that we're very supportive. I think one of the big things with us is that we're a small team, particularly within the clinical years, so we know our students. And because we've not got hundreds and hundreds and hundreds per year, you know, like it means that we know our students individually. You don't get lost. So the application process for medicine. I'm going to just talk through kind of what the process is, and then you can ask questions, and I've got some examples of some of the things that we might ask you. Okay. So the alternative qualification site here, it says the foundation program or international baccalaureate. You know, within the UK, our typical thing is 144 UCAS points with a variety of different A-level grades, you know, in case there's anybody else that's, you know, that doing it. But the reason why we ask for these kind of high levels is because it is a tough degree. And at the end of the day, we need you to be able to demonstrate your ability to work at a certain level. Okay, we're not expecting you to come in with lots and lots of knowledge, just be able to, this literally shows us that you can work at a particular level. Okay, so the English requirements, it's an IELTS of 7 with no section score below 7. We do have some resources, and the Language Academy does offer courses to include that, increase English proficiency. It's just, we need to know that there is a basic level because of patient care, essentially. That's the really important thing. And from the get-go, when you're on campus, a lot of the work you'll do is within groups, okay? So if everybody's coming in with a basic standard, we all know that everybody can go from there, and you'll be okay. So steps in the application process. So essentially you submit your application with, this can be with predicted grades or actual grades, okay? And the sooner you get your applications in, kind of the better, really, because we have a rolling sort of process. You'll be asked for a few different things. You'll be asked for an academic reference, okay? Now, our website has a very good breakdown of what's expected for that reference, okay? And it's kind of, it needs to be not just the predicted grades, it needs to be what are your strengths and weaknesses, essentially, okay? Like I say, it's very, very detailed on the website that you can send that off to your referee. You'll be asked for a personal reflective statement, and I'm going to talk about more of that in a minute, and also the interview, okay? And that's not as scary as it sounds, I promise. So the personal statement. Now, we don't use the UK CAT for international students, which is why the personal statement and interview are so important, okay? Because we think that there are ways for us to assess if you're going to have the foundation skills, the basic levels of skills that we can build on to make you a good doctor, okay? So there's a few different points on this, and you're welcome to have these slides. This information is also on our website, okay? And essentially, we want you to get across a few different things. So your motivation to study medicine. So why, okay? Do you understand the role of what a doctor is, what the responsibilities are? And it's really great if you can use personal experiences. So it doesn't need to be a paid job or even work experience. It could be experience from you being a patient or your relative being a patient. or the reading that you've done, just experiences that you've had. It's important to be able to highlight things like your academic skills. So it's not just about the grades, it's about how have you got those grades? So how have you prioritised things in your life? Because no matter how old you are, you'll have had competing things with your studies, yeah? Because you can't spend 24 hours a day studying. So we need to see your sort of time management and prioritisation and how you've got to those points. And this links in with the bottom one, which is the challenges that you might have overcome to get those good grades, okay? So if you've got any experiences, showcase them, tell us about them, because when you're in medicine, in medical school and beyond, you will come across challenges. You know, you'll have an essay to write, you'll have an exam to revise for, you'll have placement, you'll have learning. How are you gonna do that? Okay. It doesn't have to be in a hospital or a medical setting. It can be anything, any experience that you can demonstrate. You've kind of demonstrated empathy, responsibility, communication skills, because we know it can be hard to get work experience, very hard, particularly in certain countries. It can be very difficult because especially if you're sort of 16, 17, that's hard. So focus on the experience that you have had. So it could be caring for a grandparent, helping to care for a neighbour. It could be a job that you've had where you have been a team member and you can demonstrate communication skills, working with customers. It can just be also an experience where, you know, one of your friends was unwell or their well-being, you know, you've helped to care for it. What we want is not a list. I don't want a long list of what you've done. I want to know what you've done, but reflect, think about what have you learned from it? What have been the lessons? And think about how that would make you a good doctor. So unless you've learned from it. So if you've done 50 hours in a hospital and come out going, oh, I'm really tired, I'm not quite sure what I've learnt, versus you've spent an hour or two talking to a doctor, talking to patients, or, you know, helping to care for a relative or a next door neighbour or something, and learnt about vulnerability, about caregiving, responsibility, empathy, and seeing that some people's lives are quite difficult. If you've learnt all that from a lesser amount of time, I'd rather that than you try and get hours and hours and hours just because. I'd rather you have a good experience and reflect on that experience. Yeah, because in the TSS, we ask you what you've learnt. We want to know what you've learnt. So think about experiences that can show us about the caring experience, the communication skills, team working, empathy. Think about those kind of experiences. And it could just be a day here, a day there, and that's okay. So the other one I could mention is team working and communication. So this could be a school team where you've had to communicate with your school team or your fellow schoolmates, or it could be a job, like a part-time job that you've got. I learned how, you know, you think about how it's helped you to learn patience. How did you have to deal with conflict? So was there arguments within the team, or so you think and reflect about how you participated, how your communication helped to solve an issue. I know that doctors have to work well in teams. I've worked well in teams in this situation. So spell it out to us, show us, and then it's easy to go tick, interview. Yeah. The other ones are showing your initiative. Again, this could be just being at school. You know, have you shown your initiative in a project or something that you've done in a club or an activity? Because as a doctor, you're going to have to show initiative all the time. As a medical student, you're going to have to show initiative. But one of the big things as well is about work-life balance, because this is the thing, we know that medicine is hard, so you need to have some basic skills in being able to balance things beforehand. So show us that you've done other things outside of sitting down in front of a book. So have you been parts of sports clubs? You know, have you been part of chess club? Have you been, you know, done mountaineering, climbing? What have you done outside? Because you reflect it back and you think, oh, okay, when I'm a doctor, I need to make sure I have time to let my brain rest. Okay? So we want to know about these things. Okay. So you've got through that. And you're going to come and meet us at interview. Okay? So it's not a big interview like this where everybody's sat in front of you. We don't have that. Our interview is a multiple mini interview. Okay? So you have lots of little ones with one person at a time. Okay? Much less scary. We're all very nice. Okay? Yeah? And we're not going to ask you medical questions. Right? Because that's not fair. We're not going to even ask you science-based questions. We might ask you some data questions, but we're going to give you the information to look at. Okay? So, it's got a couple of different parts. We've got an English and an arithmetic test, okay? Which is basically, we just need to know that you can read a paragraph, take the information, and then write a response. That's literally it. Okay? And then arithmetic, we need to know you have a basic level of mathematics ability, because in medicine, you're going to have to calculate drugs, you know, which, you know, is our major area, and also interpret sort of some basic statistics, because when I'm treating patients and I'm looking at the best treatment, I need to know that I'm giving the best treatment. So I need to know what the numbers all mean. So there's that. It's not as scary as it sounds. But then you'll have, it's normally around 6 little mini interviews, okay? And essentially it's 5 minutes. So we're not going to ask a lot of you in each of them, okay? But they're looking at something particular in each of those. Now it could be a cognitive skill. So looking at some data, like a graph, and us asking you questions about what that means. Okay, what does that data mean? Or it could be an ethical problem. So there's no kind of right or wrong particularly. So it's more about your thinking around it. Okay, it could be about problem solving. And again, a lot of those times, it's not right or wrong. It's your thought process around it. And my biggest tip is to talk through your reasoning. A lot of people think that you have to have the answer and you just give the answer. But actually, a lot of times there isn't just one answer. So I want to know when you're sat there what you're thinking, okay? And that the best students tell us. They will sit there and say, oh, well, this is a difficult one. I think this, but then there's this. And they talk you through it. And you can see that reasoning. And we can also see your communication skills at the same time. Because when you're in medicine, a lot of the learning is done through groups and group discussions. So you need to be able to talk through your processes and thoughts. So showing us that, showing your openness to communicate is really important. This is another example. So this is thinking about kind of, think about a scenario that you've come across, you know, think about your real world experiences. So this is why I'm saying is really important. One of the best ways to prepare for this interview is to think about your experiences in life, okay, and how that applies to the GMC duties of a good doctor around communication, teamwork, empathy, etc. professionalism. Yeah, think of examples, because then you can answer questions like this. No matter how the question comes, you'll think, oh, what did I do in this situation? This is how I'll do it. So for this one, you know, you're in a group and there's some disagreement. Tell me how you'd approach this. Yeah? Talk to me about it. And you could say, well, I've actually had an issue like this before in a group I've been in. That's wonderful. You know, if you can elaborate on something, a real world experience you've had. You know, and then thinking about how you might make sure that it doesn't happen again and how you can reach that decision together. And sometimes that can be difficult. And this is a useful one where if you're not quite sure, you can talk through. You can say, well, actually, that's a difficult one, because if it's a big disagreement and it's just one member and they've got strong views, how do you get over that? So, but if you're voicing that concern, you know, that's okay. Just talk through it. Don't just sit there and say, I don't know. Yeah? Don't just sit there, I don't know.
이렇게 방문해 주셔서 감사드리고 도움이 많이 되셨기 바랍니다. 여기서 마칠게요. 네, 큰 박수 부탁드립니다.
Thank you.
Thank you very much.
Thank you for listening. Thank you.